A very good morning to you. How are you doing? I hope that you're well, you're happy, you're blessed. Karibu sana. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. And I'm very excited to be here and very blessed to be able to see this day. It's should be the 20th, actually 21st of January 2026. And God has allowed us to be here for a reason. We say that He never gathers His people in vain. So I know that today we're going to learn something. And today we're here for Afya Clinic. Now, January is Cervical Cancer Awareness Month. And we've had a discussion just before we got on air, and we realized maybe because it's January, hadn't thought of that, but we don't talk about cervical cancer as much as we should. So today we're going to take time and unpack this topic. We're going to understand what is cervical cancer, how it can be prevented, how it can be treated, and who does it affect, who is at risk. So we're going to be talking about all that today. Lakini karibu sana. Before we even get there, we'd like to know how you're doing, how your week has been so far, what you're thanking God for. And for that, our numbers are very open. That is 0721 105 105 on WhatsApp, 23814. SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. Now, to unpack this particular topic, we're not here alone. As we said, is that we have people or medical professionals who help us unpack these particular topics each and every other week. And now today we have two guests on set with us. And the first guest is the CEO of WISE Organization. We're going to be talking about what WISE Organization is, and that is Sophie. We also have Everlyne Jeruto from Liberty Cancer and Wellness Center. So we'll be talking about Liberty to also know what they do and, why exactly is it a wellness center. What does that look like and what exactly is that? All right. So join us today. If you have any question, we'll be happy to answer. We'll be happy to engage with you. So feel free to text us on our numbers or our social media pages on the comment section. On every social media page at Rachel Kahugo, I'll be able to get your feedback as well. And now because our guests are here with us already, karibuni sana. We are so glad to have you today. As we said, is that today we're talking about cervical cancer, and it hadn't hit me that we don't talk about cervical cancer enough until we mentioned that as Kahugo, I'm not a medic, but I can actually talk about breast cancer very comfortably. And it's because we've done enough awareness. Well, not enough, but we have done awareness on breast cancer. And I think cervical cancer should be the same. So I'm very excited and very eager to talk about this, hoping that we'll be able to unpack this and people will be able to understand what exactly cervical cancer is. So we are happy. Karibuni sana. Na mnaka vizuri. Yes. Asante. Maybe we start with you, an introduction. Say hi to us and tell us about WISE Organization.
Okay, so good morning, viewers. My name is Sophie Hiuhu, the director and founder of WISE. Mm-hmm. WISE is a COVID baby 2020, whereby we empower women. We started by empowering school dropouts by making wigs. So later on, the wigs came and grew to an empowerment program where we even give back to the community by giving to cancer patients who are undergoing chemotherapy and hair loss. So that is one of our thematic area in terms of empowerment. Number two, under the thematic area of health, we also deal with SRHR rights, and cervical cancer falls under SRHR. Yeah. We also deal with gender matters, GBV. GBV, we also have stigma in matters of also cervical cancer, where some women are not able to do conjugal rights. We also have education, matters comprehensive sexual education. That's where we advocate for age appropriate for kids to learn more about the sexuality education program. But on matters today, we act as a link between most hospitals and the community in terms of prevention, awareness, and also referrals for the community to the various hospitals like Liberty as our partner and also as a PGH. And then personally, I'm a palliative caregiver to patients who undergo the non-curable diseases. Those are the NCDs. Thank you.
Okay. You wear so many hats. And I remember there's a time we were talking about breast cancer.
Yes.
And you talked about how you've been able to give wigs to these cancer patients.
Yes.
And that was such an amazing job. You're doing so well. You're impacting people and the lives of people, and I think that's very beautiful. So we see you today. Receive your flowers. Tungekuwa nazo physically, but hey.
Asanteni MBCI to receive having us back. We're always happy to be here to sensitize people.
Asante sana. Karibu.
Asante.
So good to have you as well on behalf of Liberty.
Thank you so much.
Please introduce yourself.
Okay, my name is Everlyne Jeruto. I'm a hospital administrator at Liberty Cancer and Wellness Center. As our name suggests, Liberty Cancer and Wellness Center, we are an oncology center. We are a specialized clinic. We deal with all cancers, not specifically cervical cancer only. We do oncology consultation, chemotherapy, psychosocial services, nutritional services, mental well-being. So we do all. It's like an all-round thing that we do for all the cancer patients. So we are an oncology center. When we talk about oncology, it covers all the cancers. And this month of January, we are so intentional about creating awareness about cervical cancer. So thank you so much for having us.
Asante for coming. Now, we talked about Liberty being a cancer wellness center.
Yes.
Maybe let's start with the fact that it generally helps, or rather treats people who are suffering from different kinds of cancers. What would you say is the rate of cancer patients in Kenya right now?
Wow. Okay. Probably I can say that the cancer cases are going higher and higher, like every year. If you look at maybe the statistics for last year and you look at the statistics this year, you'll find that the rates are high for all the cancers, prostate, cervical, esophagus. You know, we talk about probably breast cancer so much and prostate because maybe it's most of the common cancers, but also cervical cancer. We have a lot of cancers. If we say we break down all the cancers today, probably will not be able even to cover all of them. Yes, so you find that the statistics is that the cancer cases keep rising up. So when you look at the statistics, you'll find that they keep going higher and higher every year. Yes.
What would you say is the reason for the cancers going up?
Okay, probably one of the things might be low sensitization. You find that there is no sensitization probably in the niseme mashinani. You might find that people in the rural settings do not know much about these things. They don't know much about cervical cancer. There are so many misconceptions. You'll still find people who still say that I'm not sick. Probably it's witchcraft. So you find that there is a lot of misconceptions surrounding cancers, unlike many other diseases like maybe HIV, TB, which you find that even nationally has been given a lot of platforms to be talked about. So you'll find that most cancer people still take this thing as there are still a lot of misconceptions which surrounds the cancers.
But the beautiful part about that, and it's good that you're a cancer wellness center. I have seen even on social media a lot of patients ringing the bell, and it's usually such a beautiful experience to even just watch it. I was going through a lady who took us through her journey of cancer, since when she knew she had cancer, through the chemotherapy sessions on social media, probably Mewana. And sometime she'd be like 2 weeks ago, she was alikuwa kwa sawa. She rang the bell. Letumanisha, now we are clear of cancer. And it was such a beautiful sight to behold. It's just to say that cancer is not a death sentence. Now you are a link between the community and the hospitals, like Liberty. And you've said one of the reasons why the cancer cases are going up is because people are not very ready to speak about cancer. Would you say, are we getting a bit more comfortable with time to have these conversations, to make sensitization better? Am I still having a hard time having people open up about the cancer cases?
What I would say, in fact, matters cervical, because most likely we're discussing cervical. It's a very sensitive matter. It's not like breast. Because I was thinking today of how easy we can tell our kids these are my private parts. But when we stand here and say private part, we rarely do this. But for the breast, we are comfortable to touch, you know. So number one, it is the culture. The culture that we have been brought up. This is a private part, nobody should touch it. So even going for that screening, in the mind of the people, Eva can tell you, very few have even asked, is it painful? You know, so once we go to the community to create that awareness, they're always like, this is a very sensitive part you're talking about. Even prostate cancer, because those are sexual reproductive organs. So it is something that we have grown up not wanting to address. Unlike the breast, you can even take your breast out and breastfeed a child in a matatu. The other day we had those campaign breastfeeding in a hotel. It's quite okay. But we're talking about the private parts. In fact, if early detected, the cervical cancer, which is the most highly, that leads to death, if early detected, it can be low in causing death rate. The death rate could reduce. But since people don't go, we are trying our best in the community. But it's one sensitive matter that we even gather women in a closed hall and then put it as a free space. We'll talk about the support group we are going to have on 31st. So we put them in a closed space because they're also feeling like the community is going to judge us. Did we do bad manners when we were young? For those who understand what bad manners is, yet this is a virus that is carried by men. It is not my fault as a woman. So we are trying to sensitize, it is not your fault. Number two is the matters of finances. Even creating awareness, some of us as an organization, we even go door to door. Liberty comes very handy so that we can go to the community, putting those women down for 2 or 3 hours. And they're in pain. They're in conditions, they're having the signs and symptoms, but they don't understand they're in pain. They need water. They need transport back. So matters like finances, we need to incur some costs and finances. So these are things I wish maybe the policy makers or even the government itself can look into. The way we usually hype the breast cancer awareness, cervical cancer is a killer. So it really needs to have the same keen repercussions when we are going to the ground. It needs to be given, Kiswahili we say kipaumbele sana kuliko hizi cancer zingine. So we are trying as a community, as a CBO, to reach as many as we can. But those are the few challenges we are having.
And you know what you've said is very practical, because we've grown up knowing that there are things you can't talk about even with men. You know, it's like a taboo.
It is.
We can't sit and talk about cervical cancer because, you know, we're talking about things, but and now we are in a space where we can't really sensitize about cervical cancer without feeling yet it's a killer disease.
It is.
And so today we openly talk about it because it's very important to also reduce the stigma. And we'll be talking about that. And you said you have different kinds of cancers. So we decided to talk about all of them. Hatutamaliza leo. And because January is about cervical cancer, today we're talking about cervical cancer. But for the people who are hearing cervical cancer for the first time, or wamekuwa wakisikiza lakini wakisikia ama hawajui ni nini hiyo. In layman's language, cervical cancer ni nini?
Okay, let me say that as the name suggests, cervical cancer, it's a cancer that develops in the cervix, which is the lower part of the uterus. In Kiswahili, we call it shingo ya uzazi. Other people call it mlango wa uzazi. So it develops in the cervix. And most of the times you find that it's, as Sophie has said, it's one of the most preventable and treatable cancers. It's only that the symptoms might not come out the way people expect. You know, when we talk about cancer, somebody just thinks about a lump. Tukiongea cancer, somebody knows that this is a growth. Nile yenye nikiona mahali imevimba, ama nione like for breast cancer, maybe we talk about if you see an unusual lump in your breast. So most of the cancers, you'll hear people saying that it's a lump. But now for cervical cancer, it's different. So it affects the cervix. So that means it affects women. There's a platform where we had where somebody was asking, kama cervical cancer ina affect men? And okay, it's a very genuine question to some extent, because when we talk about breast cancer, we say that breast cancer affects men, and it also affects women, and it also affects men. But now for this case, it's the women who are affected by cervical cancer.
Oh, to be a woman. Good thing we have treatments. Who is most at risk of getting cervical cancer? Is there an age group of women ambao these ones are at risk of getting cervical cancer, or it's generally as long as you're a woman, you're at risk of getting cervical cancer?
I would say generally, but at the same time, sexually active women. 14 years, was it 14 years? Was it 2010? Now it's 16 years back, where they introduced the HPV vaccine. We were going to talk about the HPV vaccine in terms of vaccination. And I look back when I was discussing this with the doctors, I asked the normal mother of a girl. Those girls were 10 years because that was the recommended age of the HPV before they get into the sexual active age. So what happened to them? Because now they're 26. This is something we wish to know. Did the HPV vaccine work? Because we usually go there and sensitize people about the HPV vaccine. But most of them hold back and ask us. Those girls were 10 years back. But now they're very, very active. 26 years, you can imagine that is the hype of sex. So I would say generally women, but also the active age, or the sexual active age, maybe preteen, those who are having teenage mothers. And you can imagine a teenage mother will have multiple partners, you know. So the multiple partners might come, maybe deposit the virus. So I would actually say a woman who is sexually active or a woman of reproductive age. But I recently had a doctor say by the caveat of between 24 to 60, then past that, because now you see the menopause has cropped in, so maybe the sexual urge is slow, but they might even have the virus and maybe discover at 65, because we have patients at 65, 70. So the symptoms are the ones that come in late without you knowing. Yes, because they're very silent symptoms. Yes.
Maybe let's go to the symptoms. We'll talk about the symptoms in general, but what are the very first symptoms, the ones that you'd realize that these is cervical cancer at its early age?
First of all, we've said that cervical cancer, at times you find that the symptoms that does not present themselves like immediately, and that is why we encourage screening. But you find that at times somebody might have abnormal bleeding. When you have abnormal bleeding, it's not like the menstrual periods that you have longer, or you just find that you have abnormal bleeding. You might have also pain during intercourse. That is for those who are already married. You might also have unusual discharge, which is smelly. It's something which a woman can be able to tell, because if your periods are maybe between 5 to maybe 3 to 5 days, and they go more days, and you realize that this bleeding is heavy, that is not normal. It's not normal at all. So when you are having intercourse, you feel pain. That is not normal. And also now this unusual discharge. And you find that at times the discharge has some smell.
Perfect. Now we have some symptoms ambazo zilitumwa hapa, and I'd like for us to go through all of them and just know which is a symptom and which is not a symptom. And I know we'll be going into the mythbusters later. So you've talked about abnormal vaginal bleeding. You've said that's a symptom. We have pelvic pain.
It's a symptom too.
It is?
Yes.
Is it the normal pelvic pain, or in just general, kuna pelvic pain, go get checked?
Okay, you know, kuna ile pelvic pain whereby even when a woman is on periods, they can feel that pain, which probably is just after the periods, the pain will go away. But if it's something persistent, if something is persistent, don't just sit at home now, say it's normal. No. You know, we have that tendency as Kenyans ya kwenda hosi when it's too, saa zile nimekuwa mgonjwa kabisa na nimelemewa, that is when I'll go to hospital. But at times we just know, nitaenda to the chemist, buy painkillers. We are our own doctors, tuna prescribe, and then at times you find that it's not right. It's wrong.
Alafu nenda hosiki wa too late. Okay. You said smelling discharge, a false smelling discharge. You talked about that. Pain during intercourse. You talked about that. Unexplained weight loss.
That can also be a symptom. So when you have unexplained weight loss, it might not be cancer, it might be any other ailment. So any changes that you see in your body, I say that the best thing is you go and talk to your healthcare provider. Don't wait until it's too late. Don't wait until it's too late.
Okay. We have persistent fatigue. It's also a...
Yes.
How is it related? I'm thinking about cervical cancer and persistent fatigue. Where's the relation there?
Okay, you know, first of all, when you are not feeling well, I think the first thing you'll feel is a headache, and then you'll just feel like umechoka. At times you will take painkillers, and you won't feel like anything is going away. So we can see that some of the symptoms, probably, you see, this is something which haijitokezi. Like now a lump which you will see and say that, by the way, I'm sick. And let me just say also that not all lumps are cancers. There are some lumps which are not cancers. So isikuwe mtu akona lump alafu aseme wamesema kama uko na lump uko na cancer. No, not all the lumps are cancers. So you find that all these things maybe the fatigue and the weight loss, probably it might be any other ailment. But it's good to check your health. Self-care.
Yeah, self-care.
Yes.
Okay, we have lower back pain. I think you talked about that. We're talking about pelvic pain. Painful urination.
Yes.
It's also a symptom. And I love that you mentioned about you could be having these symptoms and it's not cervical cancer, but it means that your body is not okay. So if you have these symptoms, go get checked.
Sure.
Also, we had Mumbi who kept telling us that it's not a checklist. Ata so naangalia niko na 3 sina zote, so niko sawa. You know, ama niko na 4 tu, so you know, hey, I'm safe. If you have ata moja, it's not a checklist. You say that your health is very important, so go get checked. Okay? Now you've talked about the symptoms. What would you say from the community and what you have seen? Because now you're a link between the community and the hospitals. And I think that's a very important part, because while you're able to speak to the people, you know exactly what you're presenting to the hospital. At the community level, what would you say are some of the causes? Or is there just one cause of cervical cancer?
Let me say, number one, cervical cancer does not have status, or any other cancer does not have status. We have seen last year we lost a very prominent, a famous gospel artist. So cancer does not have status. And interacting with the community and interacting with the doctors, mostly at times cancer is a lifestyle disease. Cancer is also, in a small percentage, generic. Because when you go to the hospital, they ask the histology. Did your grandmother, and that's why you say shosho yangu alikuwa na hii, lakini mimi kukangu alikuwa na hii, so it can be passed also generic. So apart from also, but mostly the community, now we're talking about cervical cancer, I still insist, multiple partners. And it could be a woman who is having 4 men, or one man who is having 4 women. So it could be vice versa, but men are the carriers of the virus. That is something.
And maybe it's important to note that it's already very wrong, even without talking about cervical cancer. I mean, it's just man and woman who are married. That's how it should be. You don't have to see heaven. I mean, hey.
You say even women in marriage also get the cervical cancer. Single women, we don't need to stigmatize anybody here. It's a women disease. Number one, that is enough stigma. So we don't need to say if this woman is married or this woman is not married. It is just a woman's disease because it affects the service. So there are so many aspects, and it does not even have a status. The fact that I deal with the community, I also deal with the elite in the same community, because we might be having a church gathering, and a woman pastor calls me. She could be also a patient, you know. So what really affects them is that the multiple bit, because kunaweza kuwa na baba mkate, baba nyama, baba school fees, as women we know. So that is the aspect that brings it. And again, we blame it on the economy. The economy, we blame it on the policymaker. The policymaker, we blame it on the shilling. So it's a round thing. It's really affect from the head to top. It's a big challenge facing this cervical cancer and addressing it. Yes.
And on that, talked about the HPV in terms of treatment. Do we have other kinds of treatment apart from the HPV, so that you can come to the HPV treatment?
Okay, probably maybe just adding to what Sophie has said, you are asking the main cause of cervical cancer. It's now where you talk about HPV, the human papilloma virus, which you find that when somebody is infected with HPV is when now they get cervical cancer, and this is spread through sexual contact. So the sexual contact is how one is spread through. And so the HPV infection, they see that it clears over time, but some can lead to cancer if not detected early. So for cervical cancer, when one has already been diagnosed, there are treatments. We have chemotherapy. Chemotherapy is whereby the medication is given through the veins. We have radiotherapy. Radiotherapy, I think most of the people in a very layman's language, they use ile word ya kusema kuchoma. It's not like unaenda kuchomwa, those cells, but when you talk like kuchomwa is how they understand. So there is radiotherapy, and there is also a treatment called brachytherapy. That is the treatment for cervical cancer. And the good thing is we have a lot of patients who have gone through all these treatments and are okay. Yes, very much okay. Next time we will come with one of them so that they can give their testimony. You know, seeing is believing. So the good thing is that all these treatments, when you come to the facility, the doctor will explain to you step by step the treatments that you are going to receive, and once you receive all these treatments, they go back to their normal lives.
And it's good that we've talked about the treatment and the different kinds of treatment. Nokamaliza na kusema that there are people who've gone through these treatments and they're well. They're living a very normal life.
Exactly.
And we'll have one of them very soon.
Yes.
Maybe let's go back to the HPV. We've talked about human papilloma virus as the virus that causes cervical cancer. And you talked about the HPV virus or the HPV vaccination as a vaccination that's given to young girls to prevent them from getting cervical cancer at their later age. Maybe take us through that.
These young girls, we assume that at that age they are not sexually active. I know society has changed so much right now, such that when you look back to during our, maybe let me talk about my times, we used to say that that age, you would not even hear a girl saying that they have a boyfriend at that age. So the age of 9 to 13, they are young girls. We say that these girls have not started engaging in sexual activities. So when they get this vaccine, we are preventing them so that by the time they are sexually active, it's like already they have some sort of prevention. So we are like preventing early. Tunaanza mapema. It's like you are starting today, something that might happen tomorrow. So we are preventing today for tomorrow.
What are some of the myths that you've had in the community about cervical cancer and then HPV?
And that is why, as much as we work closely with the hospital, at times even personally, I tend to differ because I still go back to the drawing board. What happened to the first batch that were diagnosed some years early? So the myths are that in fact your virus and your kuongezea cancer, because cancer is a cell regenerating cell disease. It's multiple cells here abnormal cells. Actually, it's the abnormal cell. So they'd rather say, I'd rather have a family planning pill or use a condom during sexual intercourse than nidungo hiyo shindano. Itadungo shindano ya prevent mimba tena nidungo shindano ya HPV. Once they just hear the word virus, the only vaccine they understand is akina TB, akina polio, and that is why I think there's a gap between the government and the common mwananchi matters cervical cancer. The HPV vaccine itself, because I was following up a discussion whereby the Catholic Doctors Association is against the general doctors who also prescribe. It was a fight. In fact, there's one professor who died along the way because of mental health or something. It was a fight. So if the big people who are supposed to diagnose us, the medics themselves are fighting, what am I supposed to go and tell the community? So as per now, the myths are, the vaccine itself ni kukuongezea nini? Ni kukuongezea ugonjwa. Siwezi dunga hata siwezi ngusha mtoto wangu.
And that's a myth.
That's a myth. That's a myth that's supposed to be debunked anyway by health professionals. For us, we still fall under the community as much as we also interacting with the doctors. That is something they're supposed to come out and tell us the real thing about the vaccine, debunk the myth, the way of mitigating it directly to the community, and the direct. So this is something that the health ministry itself should take it up. So as per now, it's still a fight. Even if you search it up, it's still a fight. You see the way Catholics are always against the controversial things. They call them also the myth. They are not for family planning. They are not for such vaccination. Actually, when the vaccination was going on, most schools in Nakuru County were not vaccinated because people, mtoto wangu hataenda shule leo, wako alienda, it was even on social media, wangu aende kama anaenda kudungwa, si bila ruhusa yangu, no. So that is something that we as mothers have not accepted.
Yeah.
Let me say mothers, because we are responsible to our children. Yes.
Maybe just to add to that, you've mentioned something that the HPV virus is like any other virus, or rather the vaccination is like any other vaccination. And what a vaccine is that virus that's introduced in the body so that it will prevent that particular disease.
Yeah.
And it's very important for us to note information. We say information is power. Yeah. See, when the word says that we perish because of lack of knowledge. So once you're able to know and understand what exactly something is, you're able to walk in the wisdom and knowledge of that particular thing very well. And so we say that this vaccine is like any other vaccine. We'll take an example with COVID.
Sure.
The COVID vaccines, ilikuwa ni COVID kidogo unaekewa, unajua? So that, and that's how it is, so that your body already has the
kinga.
Iko na kinga. And so it's very important, and as you said, is that it's the mothers who are responsible for these kids, because they won't make the decisions for themselves. Ama?
Yeah, sure.
Yeah. So you umewambia, please look at that camera and tell the mothers they are responsible for their children, for their girls.
Parents, let me say parents, because now this is cervix, and also men know, they understand the concept of the cervix in their life. So basically it's the parent, but at the same time, I want to say this, Kahongo, that the responsible bodies should come out clear. Like we have a door-to-door sensitization on polio and TB.
Yeah.
They should even come door to door about the HPV, because it has been resistant to the community. The community is actually, I can say, 2%.
Yeah.
And therefore those who can understand Google and talk about it. But when it comes to treatment, we are treating 34-year-old, 86 years old, 70-year-old. So what is the gap? Because now this is 34, she's well informed. This is an 80-year-old woman, cervical cancer.
Yeah.
She never even knew about the vaccine existed. So there's a very big gap in terms of information. So we try our best to do it to the community, but the relevant bodies, that is the Ministry of Health, they should try and disseminate the right information, especially about this HPV. Bring so many people on board and educate them. The pastors, let these pastors be aware. We have pastors who come, they are diagnosed, but they go for fasting because they believe, no, this is also a religious thing. They believe by fasting, cancer itanitoka. Within 1 week, we are burying the pastor. You see?
But I would like to maybe just put it clear on that God, we are not disputing that God can heal. And we believe in that, truly believe in that, but there's the place of doctors. So it's a mix of both. Pray, God will heal, but He's also given us the doctors, yeah? So you despise one,
because
it becomes
urine fast is affect nutrition and you're under medication.
Yeah.
So you see, once the body does not have anything and you're taking the medicine, there's not going to be any effect.
Yeah.
So actually what you're saying is right.
Nutritionist.
Yes, you walk, God heals, the doctor treats. So the two of them zinapelekana.
All right.
Yeah.
All right, now let's go to the prevention. We've talked about the vaccine, which is very important. Is there any other way of preventing cervical cancer?
Okay, since we looked at the causes, we talked about multiple sexual partners. So one of the way that we can prevent, of course, is have one sexual partner. We should not...
which is your husband?
Exactly, which is your husband. And if you're not married, you wait. Yeah, if you're not married, you wait. Yeah, so one of the way that we can prevent is to have... avoid having multiple sexual partners. Another way now is screening. And that is where now we keep telling people, please do regular screening. We've said that cervical cancer is not like any other cancer that you might see the symptoms like immediately. But when you go for screening, if you go for screening and it's detected at a very early stage, it's treatable. You know, the beauty about cervical cancer is that it's preventable and it's treatable. Yes. So regular screening. Go for screening, go for checkups. I know that when we talk about going for screenings, even when we say that this month, like us at Liberty, we have free cervical cancer screening the whole of January. In respect of January being cervical cancer awareness month, you'll find that very few people will come out. But if it was breast cancer, we would have a lot of people coming for the screening. So, and also the fact that tumezoea ile yenye nikikuwa mgonjwa ndio nitaenda hospitali. So if I'm not sick, why should I go? Unaona? Why should I go to hospital if I'm not sick? So when we talk about screening, it's good. Not only this month of January. Probably kuna mtu anaona like January sitaweza, but any other month, just walk to our facility and say that I want to do a cervical cancer screening. It will be done. Yes.
Okay. We'll be talking about screening and what exactly that is. And the question that you asked, is it painful? Because you've had people asking that, does it have some side effects? Okay. So we'll be unpacking that. But for now, I'd like for us to get the Vox Pops. So this is to understand what people know about cervical cancer. Do we need to do more sensitization to know where we stand as a community in the matter of cervical cancer? Let's get the Vox Pops.
Cervical cancer sijui kabisa, lakini yenye nimesikia wakati nimekuta watu wa kipimo, nimesikia kuna virus ambayo inapatikana kwa wamama sana sana. So inapopatikana, asipotibiwa ina develop hiyo cancer. Sijui hiyo ndio ina cause. So sijui vizuri, lakini nasema kulingana penye nimesikia.
Cervical cancer ni ugonjwa ambayo ni hatari na it is dangerous kwa sababu it is killing na inaondoa good people into the society na inawaua wakati wako in the middle age, na ile yenye inawachukua kabla hawajamaliza their purpose in life. Most of the time kenye natuma cervical cancer inatembea sana, most of the time nitaanza na food content. Genetically food zetu zimekuwa zikiwa zina influence na chemicals, na tunajua virus inaweza kaa kwa chemicals ndio iweze kuspread out haraka. So the time enyo watu wako jikoni wakipika, virus ikiingia kwa mwili sasa inaenda kwenye na nini like eggs, kuku, na hizo ndio ladies wanapenda kukula sana. Because of the cervical cancer necrosis, because zikitoka upande ile maybe tumezitoa abroad, wanafanya huku kwa dumping site, na tujui the effect of those causes venye ziko, na hatujui kama zinatreatiwa before they alive in Kenya. Another thing is that like medicine, people are quite enlightened in medicine. Alafu ingine ni the cause ni hiyo kunyamaza, kukua silent. Hautaki kwenda kuona daktari, hautaki kuspeak out. So the environment yako tu body na unastukiaga wewe ni mgonjwa na ujulikani. Inakuwa tu the effect hivyo.
Story na cancer, hiyo kuna hiyo virus ya HPV. Na hiyo virus inaffect wanawake sana sana. Inaweza prevent through surgery. I think surgery inaweza preventiwa.
Cervical cancer mostly inakosiwa na hizi manguo za ndani za wanawake zenye wanatoa from abroad. Hizo ndio zinakuja zinavaliwa. Hata kuna time serikali ya Uhuru ilikuja ikakataa wasi import hizo nguo. Hizo ndio the main. Alafu ingine maybe ni kutooga na kufanya mapenzi na mtu mwenye ako na ugonjwa, hiyo ugonjwa, alafu usiende kutibiwa.
So that is it, and I know our doctors have a lot to say there, and so we'll be giving them this opportunity. So that is what we had. That's just a small group of people, just a pinch of the community. Mtasema tuko wapi? Nimeona reactions and while you were listening.
Apparently, these are men.
Yeah.
They are men who are responding to this.
Yeah.
And the last one at least had an idea. Apart from kuoga, that causes cervical cancer, he has an idea, mpenzi.
Yeah.
So he has an idea, it could be sexual, transmitted maybe virus, you know. But this is the ground. And this one has even given me an eye-opener. Maybe as a community-based organization, the awareness we are creating we are doing it in the wrong way. We are only targeting women who are infected. But these women are the carriers. So, in fact, this is a very good eye-opener. Today I walk out here knowing that the next awareness I'm going to create is going to be a men engagement forum.
Yeah.
Because they should know they are the carriers. Umesikia wa GMO na ngoza kutoka abroad Uhuru alikataza. So that is a clear indication that men have no idea they are the carriers of the HPV virus.
Yeah.
Yes, that is the community.
Okay.
And thank you so much for that information.
You've mentioned something. Let's touch on that. You've talked about men being the carriers of HPV.
Yes.
You know, some would think, oh my God, so I'm sick? What do you mean? Please explain.
Okay, we've said that the main cause is the sexual intercourse. Okay, you find that a man is a carrier, but it doesn't mean that a man has cervical cancer. I think we need to put those two kabisa kando kando, yeah? And first of all, I want to thank the men because they came out and talked about cervical cancer. Probably, wengine wangeulizwa wangesema cervical cancer, go and ask a woman. I don't know anything about the cervix, but even coming out to talk about it and saying what they think about it first is big ups to the men out there. And so it doesn't mean that they are sick, but they are the carriers. And how they are going to help us is to encourage their spouses, their wife, to go for screening so that they can, if they have cervical cancer, it can be detected early. So that is how the men can help us. The men also can help us to make sure that their girls, just the way Sophie talked to their parents, their girls go for the HPV vaccine so that we are going to prevent them for tomorrow. Yeah, so the men babaike waseme like, hey, wamesema ni sisi, so mimi ni mgonjwa. No, they are not sick. They are the carriers, but they can help us to sensitize their spouses, their wives, to make sure they go for screening. Yeah.
All right, now let's go to the screening. And talk about exactly what screening is. When a woman walks into Liberty for screening, what happens?
When they walk into Liberty for screening, first of all, I want to remind them that screening is going on even today. You walk there today and the screening will be done absolutely for free. So screening for cervical cancer, just the way we had said earlier that when we talked about the private parts, if it's breast cancer, somebody doesn't have a problem at all getting screened because they know that it's just palpation. Breast probably ya breastfeed watoto. It's something which I can do in public and I'm so comfortable. But now when we go to the cervix, hapo ndio kunakuwa na kizungumkuti. Somebody thinks like, okay, so I have to show out my cervix. And you know, there's this Swahili saying which says that ficha uchi azai. Yes. So screening for cervical cancer inafanywa kabisa huko kwa cervix. So we have a screening called via villi. And we have a screening called pap smear. So via villi, you'll find that mostly it will be done for girls when you wako age ya 20s. And this is just a test yenye. The nurse will do the test and then they will be able to advise if they need further investigations to be done. And then there is a pap smear whereby a sample is collected. This sample collected will be taken to the lab. And the process which is going to be done there is called cytology. So once the results are out is when now the healthcare provider can communicate with the patient that this is how your results are. If the results are good, they can be given 3 to 5 years to do the screening again. But we also encourage people who have other diseases like maybe HIV, any other diseases, that they need to be doing routine screening because they are at a high risk. But when you come there, it's not something whereby ukifika tu ninakufanyia screening immediately. We have personnel who are trained. They will talk to you first. They will tell you, this is what we are going to do. They will explain to you the procedure, what is going to be done. And I can say that it's not painful. It might be a bit uncomfortable, but it's not painful. It's not a painful procedure. So somebody should not fear that I'm not going to do the cervical cancer screening because of the pain that I'm going to experience. It might be a bit uncomfortable, which the healthcare provider who is going to assist you will be in a position to explain to you everything that is going to be done, such that by the time you are going for the procedure, which will not last, it does not even take like 10 minutes. It's something you can go and go back to work. It's not something like you have to take an off day from work so that you go for screening. You can just get out of your office, walk to the facility during lunch hour, do the screening, go back to work. Nobody even will know that you have been screened, but at least you will have taken charge of your health, and you will know that I've done screening. And you will get the results. We will communicate.
Okay. It's very good that you've explained it very well.
Yes.
And the fact that it doesn't take, it's not painful, it doesn't take 10 years.
It doesn't.
You don't have to take a whole off day. No need to screening. You guys, I'm going for screening. It's just like 10, 15 minutes and then you'd be good. And you've mentioned that take charge of your health.
Yes.
We say that your health is your responsibility. Really, no one is going to take responsibility for your health. And once you've known what you're supposed to do, if you go to hospital later, like 5 years later, and it happens, God forbid, that you have cervical cancer, and it's something that today you know that you should have gone for screening and detained, then utakuwa unajua ni mimi nilidecide stay kwenda screening at that point. But then we say that it's very important for us to know that once it's detected early, it's very much treatable. Okay? Now, we have a lot of stigma, and we've talked about that, Sana, that's surrounding cervical cancer, to a point where we've had that the men don't have the knowledge, kabisa, ambao wanatakana kuwa nayo about cervical cancer. Now, what is the role, what would you say is the role of these men and the community at large in supporting and helping these women who have been diagnosed with cervical cancer in their journey of, healing through them going for chemotherapy? Do they support in any way?
Unlike breast, though breast also comes with stigma, the rate of stigma in cervical cancer, I might say, it's quite high. It's over 50%. Because number one, this involves conjugal rights. You have heard the symptoms are painful during sexual intercourse, and the man might not know this woman is having those symptoms of cervical cancer. So the stigma starts there. During sexual intercourse, there are those feelings. There's so much investment during the act of sexual intercourse. So the man will pull back. The man will start stigmatizing this woman. You are no longer the woman I thought. You gave birth, just like the way women gave birth, and then they are stigmatized. You're no longer the girl. So number one, the esteem, self-esteem for this girl or this woman drops immediately. But apparently, I can't blame the men, because if these are the men who are saying what cervical cancer is, they will not even translate as a matter of sexual intercourse. So men need to be sensitized. Number two, it also comes with budget implication, cancer. That is where now we come in as palliative caregivers. Immediately from step one of diagnosis, we usually take of the holistic, apart from pain management, we usually take care of your mental health in terms of finances, social life, in terms of the environment itself, because most women have also divorced. We are in so many support group, oncology support group, nutrition support group, because cancer is not a cheap disease. That is something we need to address, maybe with the stakeholders, and we need to understand. Recently, the SHA dropped from last year to this year. Whatever is being paid by SHA, it's not even the same. Patients are crying outside there. So men need to be guided. And that's why I'm saying today I walk out very empowered by this program, by what I've just realized. Because as a women organization, I think there are things we're supposed to address using the people who hold the power. At this point, the men hold the power when it comes to the sexual intercourse. As much as we women, when you say my body, my choice, we want to be loved by the same men, we want to feel appreciated. And if a man is not appreciating you physically, then emotionally he will not connect with you. Then that woman drains emotionally and disappears and disappears. So we really need to empower these men, engagement. They can even feel comfortable taking these women for the treatment, just like we support their men during the prostate cancer awareness month. So many women as caregiver come also supporting their men. But on the flip side, if I can tell you, those women are walking to that clinic alone. Either they are married women, they are single girls, or they are mothers or what. They are walking as a woman alone. These men need to be sensitized and reduce the stigma to these women.
Okay.
Yes.
Okay, how about the community?
The same will translate to the community because for most women, they might even think, I've had several cases, that she had mentioned something to do with HIV. When I've worked with patients who was also HIV positive, and this particular one was a barmaid, and the husband died out of, he was a truck driver, which was also a cervical cancer. So when I say truck driver, without stigmatizing, you can imagine the number of times he spends at home with the wife. Most of the time he's on the road. So that is how the lady was diagnosed. And now she even got HIV. So the community, and this woman was a church woman, so the community branded her as a woman mwenye anaenda ndo anazurura wakati bwana ako nje. But umesikia the career of this man, he's a truck driver. So apparently, but the lady now succumbed and she passed on. But when she came crying, she was saying, mimi sasa hii community imenitenga. The symptoms of cervical cancer, excessive bleeding, even smell. There was a place I was, and somebody walked in and said, huku kunanuka aje kama cervical cancer. It was a facility somewhere I had gone for some counseling. Somebody just walked because the smell. That's a very
careless statement.
Very careless from just a man, actually a man who just walked in. Yeah, huku kunanuka cervical cancer, you would know. You know? So that woman alikuwa ametengwa, hataenda ushirika, hatapanda matatu, even means of commuting. Itabidi umetandika Macintosh, kwa Uber. Cancer is an expensive disease. It comes with a lot of stigma when you relate to this patient. And in fact, most of them lose it mentally before they even start treatment. And once they lose it mentally, they go. And that is what I had most of the community saying during the famous lady, the musician who died, that she was just shocked by the news. Myeloma, she was just diagnosed and she was shocked because the fact that alikuwa amefura mpaka mwili, that was shock. The news was not properly broken through. That is something the late Reverend Kiuna survived with for so many years, even Bob Collymore. But now our only musician, it was just maybe ambushed and she passed on. You know?
And it's good that you've mentioned about how the community would be able to come in terms of supporting mentally. You talk about mental wellness, Sana. And while I was starting, I said that when it's Mental Health Awareness Month, we talk about it. We talk about, in general, we have the general Mental Health Awareness Month. We have the Men's Mental Health Awareness Month. So we talk about mental wellness sana. And maybe this is the place we bring it in again. Sure. It's very important for anyone. And by this we're talking about any disease. Mtu yote ambaye ni mgonjwa, what they need sana is for them to be psychologically well. Once wako sawa psychologically, then you can be sure watapona.
True.
So be that support system. Whether it's someone you're related with, or it's someone you are friends with, or it's someone who is in your community, be the reason why this particular person is going to be well. All right? So at this point, we'll take a very short break. It's 9, so we'll take a very short break and then we'll be coming right back. Just to remind you that today we're talking about cervical cancer. And as you realized, is that it has everything. It's an emotional discussion, but it's very, very informative. So do not go. Call in other people so that you'll get educated as well. This is MBCI TV and the show on air is Afya Clinic.
MBCI Television, transforming lives.
This is a gathering of champions, a release of mantles, a time to position for the new dispensation. Kingdom Seekers Fellowship Thika Road, together with the senior pastors of Reverend Esalom and Pastor Julia Karanja, invite you to a life transforming gathering of impartation, revelation, and power, dubbed the Impartation Dominion Conference, featuring seasoned ministers of the Word of God, Apostle Michael Oropo, Apostle John Kemani William, Reverend James McCoy, Apostle David Juma, and Apostle Julia Subi. Come and receive divine authority to walk in new grace and revelational knowledge. Date 10th to 15th of February 2026, daily from 9 a.m. And the Sunday rally is our climax from 2 p.m. to 5 p.m. Venue, Kingdom Seekers Fellowship Thika Road. Theme is derived from Genesis chapter 1 verse 26. Come, be part of the Impartation for Dominion Conference 2026. See you there.
Yesu alipozaliwa aliletewa zawadi 3. Ilikuwa nini na nini?
Shut up everybody. Listen.
Samaki.
Samaki peke yake. Mnyama anazaliwa akiwa pregnant. Ni mnyama mgani?
Hey y'all, come look at this.
Konokono.
Nataka urudie mara 3. A lorry warrior will rarely worry. A lorry warrior will rarely worry. Rudia mara 3 mbio mbio.
It's about to go down.
A lorry warrior will rarely worry. Rudia mara 3 mbio mbio.
Ali warrior la ngol golia. What? Ali warrior la ngol golia. Ali warrior la ngol golia.
Transform your sanctuary with high-quality church chairs designed to bring comfort, beauty, durability, dignity, and elegance to the house of worship.
Eshkol Furniture Solutions presents a church chair with a strong frame, crafted from pure virgin metal for exceptional strength and durability, and coated using high-pressure, high-temperature painting technology to resist scratches,
Giving the chair a shiny, long-lasting look. This elegant and comfortable chair design comes cushioned with high-density foam, guaranteeing the comfort of every believer during church programs. Available in a wide range of colors to complement your church theme, with the option of embroidered logo for a distinguished touch of identity and elegant look. Replaceable seat covers are also available on order. The chair is built with practical functionality in mind, as it comes with an option for under-seat rack, perfect for holding Bibles, hymn books, or personal items. Its studded size saves space and allows for easy stacking, with protective plastic pads to prevent clutching. It's simple to arrange and offers flexibility for any church setup. Upgrade your sanctuary today with these premium church chairs. Prioritize the comfort of believers, beautify the sanctuary, and restore dignity of the house of the Lord.
Order today on 0757 444 333 or email us at eshkolfurniture@gmail.com. Eshkol Furniture Solutions. Passion for excellence.
MBCI Television, transforming lives.
Right, we're back. Thank you so much for staying. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. My name is Rachel Kahugo, and today we are here for the Healthy Living, or rather the Afya Clinic. We'll be getting the Healthy Living segment later. Now, today we're talking about cervical cancer, and that is because January is Cervical Cancer Awareness Month. We've talked about so much, and I hope that you are learning. We still have people who are sending in comments already. Please feel free to send in your comments on 0721 105 105 on WhatsApp, 23814, or SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page. On all social media pages at Rachel Kahugo, I'll be able to get your feedback as well. And I say, Anita Martha, just read 3 feedbacks. Martha Nyambura anasema I'm following to learn. Asante sana. We have Siwili Smith. I realized we have very unique names here, which is really good. Anasema very good information. Asante sana. We have Patrice going anasema yuko tuned in from Nakuru. Thank you so much. We have Mike Njoroge. Nono anasema you tuned in. Okay. I see your message. Asante sana, will be answering that question as well. Naona hiyo support, not a support group, sensitization. You said utakuwa na a conversation with the men. Naona that would be very important. Kuna watu wanauliza maswali na wamesema they also want that. So we'll be giving contact, and where you do that. Is it in Nakuru? Outside, we'll be talking about that, okay? Now today in studio we are having 2 people with us, and they're helping us unpack this particular discussion. And we'll start with the CEO of WISE organization. Asante sana for being here. That is Sophie. And all the way from Liberty Cancer and Wellness Center. Asante sana, Everlyne,
Thank you
for being with us here today. We've talked about so much on matters of cervical cancer today, and I'm glad that we've been able to do that, because that means that the people in general, not only men, but people in general, have been able to understand what exactly cervical cancer is, the causes, prevention, all that. And if you have any question, bado tutakuwa tukizijibu. You mentioned that you have screening that is ongoing at Asai, Palliative.
Yes.
Tell us about it.
Okay, Cervical Cancer Awareness Month, it starts from the beginning of January until the end. So, as a facility, who I told you when we started that we are so intentional about creating awareness and making people, making sure that people know about their health. So we are carrying out screening through the month, absolutely for free. You don't pay anything. I know that somebody heard me saying that about pap smear, that we have to take the sample to the lab, and probably they are thinking that, oh, so when I go there, I'll be charged for the lab. No, we are doing it absolutely for free. It's like a CSR activity that we are giving back to the community this month of January. And as we continue with the screening the whole month of January, we have patients on treatment. We have patients who already finished their treatment. We have patients who are just starting their treatment. We have those who we say are newly diagnosed. So at the end of the month, we will have a support group meeting. This support group meeting is to bring all this together. The patients who already completed their treatment, the ones whom I said that they have gone through all those treatments and they are now okay. They are going on with their activities, wako job, wanaendelea na kazi. So this at least shows people that cancer is not a death sentence. You can get treatment and you will be absolutely okay and go on with your daily duties. So this, they are going to come. The patients on treatment are going to come for the support group. Those who are diagnosed are going to come for the support group. And the main purpose why we have this support group is to foster a sense of belonging. You see, when you come together, people who are going through the same diagnosis, you will feel like, oh, kumbe I'm not alone. You know, at times somebody will feel like, unaona kama tuliongea hiyo maneno ya stigma, somebody feels like I'm alone in this journey. But when we come together, it shows, it brings a sense of belonging. Like, oh, there's somebody else who has gone through this journey, na amemaliza, and they are doing well. And even that person who is about to start treatment will see that this is possible. I can go through the treatment and I'll be okay, and I'll be back to my normal self and back to my duties. So we bring them together, we share experiences, we give them time to talk about the stories. So the theme of this year is empower the storyteller. Yes, we are empowering them to talk about it. Because we find that cervical cancer is it has not been talked so much about, like breast cancer, prostate cancer. There is a lot of stigma still surrounding it. But we are happy because we have those advocates who are talking about it, telling their stories. This is where I was and this is where I am. So we are also going to look into that theme to make sure that they tell their stories. How did it start? How do they feel about it? And through this, we are going to educate others. Those who are the caregivers also, we give them the platform to come for these support group meetings so that they can also share their experiences of how they are caring about these people. So in the support group, we have doctors, we will have the counselors, we have the nutritionists. So it's a very beautiful session. Yes, it's a community. We come together, we learn, we eat, we have fun, we dance. Yes. So we will have it at the end of the month, 30th of January.
30th of January.
Yes.
Okay. Perfect. So for now, I'd like for us to go through some of the mythbusters. And it's good that you've talked about the support group, because this is also where we get to, debunk the myths and just know how to go about it, to know if is this true, is this not true. So let's get the mythbusters. And the first mythbuster is that the HPV vaccine prevents all cervical cancer. Is that true?
All cervical cancer. Okay, the HPV vaccine, we say that it prevents, but it's also good after the HPV vaccine. There's this time whereby this ladies will start being sexually active. So you should not sit at home and say that mimi nilidungwa HPV when I was 9. You have now started engaging in sexual activities. So it's still good to go now for the regular screenings. Yes.
Okay. So it's a combination of both.
Yes.
Okay. The second one says that a screening, that is pap smear and HPV tests, is painful and embarrassing. Is it?
It is not. Yeah, it is not. I've said that it might be a bit uncomfortable, but it's not painful. It's not embarrassing. I'm also sorry to say that probably there are some women out there who have gone to other places, other facilities, and the experience was not so good. So when you find someone like that and tell them that we are doing free cervical cancer screening, they have that fear, like, before I did not get a very good experience. So it's not painful, it's not embarrassing, it's good. You know, hawezi sema ni aibu kujua afya yako. Haiwezi kuwa aibu for real.
Okay.
So we should kwanza hiyo kabisa hata haifai kuwa hapo.
That's a myth.
It is.
All right. And the other one is that cervical cancer only affects older women.
No. No, it does not. So long as you're sexually active, you're prone to cervical cancer.
Okay. And the other one is that using family planning methods causes cervical cancer.
No.
No?
No.
Okay. The other one is that cervical cancer is caused by witchcraft or curses, especially that. You know, I've had that, and not only cervical cancer.
All the cancers.
But the cancers in other diseases. People talk about that as witchcraft. Ulikosea mtu nyumbani, that's why.
Ukarushiwa your cancer. That's not true. And that is why sensitization, especially in the rural settings, you know, that is where you'll find people saying that ameenda kwa mganga wa kienyeji kwa sababu alirushiwa, sio ugonjwa, ni uchawi. No, it is not. So you find that somebody will go to this the traditional medicine. I'm not saying that traditional medicine is bad, but you'll find that somebody will go for traditional medicine. By the time they come to hospital, the cancer has spread. Probably when they started going for these other medications, it was stage 1. By the time they come into hospital, it's stage 4. Yes. And this cut across all cancers, not only cervical cancer. So it's good to make sure that anytime that you hear that you have cancer, don't take time to like, I'm waiting, wacha bado ningoje, uzuri hata sisikii uchungu. No, please, if the healthcare provider advises that you need to start treatment, start treatment
immediately.
Yes.
Okay. And the other one is that cervical cancer is caused by poor hygiene. You know, when you had someone say that ni kwa sababu watu hawaogi vizuri, I saw your reaction and I said, watakasirisha bure hapa. You know, tell us, is hygiene and cervical cancer related in any way?
Nothing completely. Nothing. So these are the myths we really need to debunk. Because information is power, as you say. And this clearly shows that the community, it's a pity state. Because imagining the repercussions that cancer comes with, and this is what the information that the community has, it's a very sorry state. So these are things that we really need to go down to the community and sensitize them properly, especially these men, as we are saying. And we'll also take an initiative of inviting also men to this support group that is coming on Friday, the end of Friday. So that at least they can come out with, they have demystified such myths. You know? It's a very sorry state.
All right, the other one on the Mythbusters is that washing the female reproductive organ with herbs and chemicals prevents cervical cancer. What would you say? In fact, you shouldn't. I mean, hey.
You shouldn't.
That's dangerous.
Like washing with chemicals. Chemicals in the first place. You know, when we talk about chemicals, it's like Jik detergents. So you shouldn't do that. So somebody should not start washing herself with chemicals that is going to prevent cervical cancer. No, probably even you might be causing more harm to yourself.
It is actually causing harm.
Okay.
Yeah.
So that is it on the Mythbusters, and it's good that we've been able to demystify that. If you have anything else that you've heard and you'd like to know if it's true or not, please feel free to send, and we'll be happy to read your feedbacks. You had mentioned about once someone has been diagnosed with cervical cancer, and this is not only for cervical cancer but any other kind of cancer, there's the palliative care. How do you go about it, and what does that include?
Basically, I'm a trained palliative caregiver, and we are all caregivers, directly or indirectly.
Yeah.
If you've ever taken care of a sick person, either you're a non-medic or a medic. A caregiver can be a non-medic or a medic.
Yeah.
And that is why I've been seeing the hype of mesabrufen, you know. You have seen the mesabrufen hashtag, because automatically we become, that is caregiving in any pain.
Yeah.
So caregiving is basically managing pain symptoms by supporting the patients emotionally also. We work alongside with the doctors. We don't work against doctors.
Yeah.
So the whole stage Eva has been explaining here, you can imagine that patient from stage 1 to the last stage. And most people assume that most patients who are on palliative care, they are on the end of life. No. We usually make the patient's life manageable by managing the treatment bit.
Yeah.
So we work closely also with the caregiver, because the caregiver, we usually say, is a frontline soldier, and this is a person who become sick.
Yeah.
Taking care of that person and the state of mind also for that caregiver themselves. So we holistically take care of the patient and the caregiver.
Yeah.
So I want to give an example in terms of stages. We have worked in Liberty. We have done the screening. After 1 week, you have been told the results are here.
Yeah.
The news has been broken that you have cervical cancer. How would you take it? They also offer free counseling.
Yeah.
That is where we come in as a counseling support group, because this patient is worried about the finances implication, number one.
Yeah.
Cancer is very, very expensive. This patient is worried about the society.
Yeah.
This is a woman whose cervix is not right. So, number one, what did this woman do to deserve that? We have just debunked the myths. So the woman will always be blamed because she's sick. So her mental state in the society comes in. This woman is worried about the fear of the unknown. Basically, we walk with the fear of the unknown, step by step. So palliative care giving, it's very important in every stages of life, especially for these non-curable diseases. Apart from any other diseases, the NCDs are the main stages that they really need caregivers like us. These are the hard things that even most of the people say, call their CNAs, in terms of cleaning. Cleaning an adult is not a good thing that you'll go back home, have nyamachoma and sleep. So it really takes a caregiver to be empowered so that they can also walk the journey with the patient. So we take care of the patient and the caregiver, and that is the essence of the support group. We come and hold them together because most of the caregiver cry and say the patient does not understand. Also, the patient does not understand the caregiver and is also exhausted. So who takes care of the caregiver? Who takes care of the patient? So that is where we come in and carry that load. We give them hugs, we talk to them, we give them handkerchiefs, they cry it out, the workload is now reduced. So basically that is the holistic about caregiving, pain management, and also support them emotionally. Yes.
And I love that you've talked about supporting the caregiver, because sometimes you don't look at the energy it takes to be a caregiver.
Sure.
And it takes so much, and sometimes it can drain you, really.
It does.
It does.
Yes.
So it's good that we have a support group for the caregivers as well.
Yes.
And you've talked about everything that it takes to take care of a sick person, and to do it with love, but also taking care of the one who's doing it. Again, that's very important.
Yes, we sync them. We sync them because most of the time they may differ. You even find that a patient does not eat when the caregiver is feeding. But once you walk in, so the caregiver will feel like I've cooked, I've done everything. Now this patient is looking at me like I'm the bad one here, yet I'm the one. So you bring them together to be in sync. So that is the main essence actually of the support, because the caregiver, as I'm telling you, they are usually sick twice. And then we walk them through the journey. Unfortunately, maybe when patients are calm, now we also start another journey with this caregiver, because this was not foreseen. To some extent, when the staging is late and this patient is nearing the end of life, now you start preparing the caregivers. This is going to happen, this is not. But mostly in stage 1, it's just a management disease, and the patient bounces back and everything goes back. But the patients who are towards the end of life, that is where the caregiver mostly is needed. You support the family even decision making. The patient wants to be buried in 3 days. The patient wants this. The caregiver said no. So you try. It's a lot of emotional damages that usually happen when we try to damage control all the emotions. So we bring them together during the first staging or the end of life stages.
Oh wow. God will give you the grace for that.
Amen.
Because clearly that's a lot.
Amen.
That's a lot. But I always say that being a medic is really a calling. You and I, ni calling.
Sure.
So God will give you grace for that. Now I'd like for us to get this particular segment, which is the healthy living segment. We just get to learn a thing or two about living a healthy life. If there's something you can do to prevent cervical cancer, whatever it is that it takes for you to live healthy. So that is what we'll be seeing, and then we'll be coming back as we wind up.
Hello and welcome to Afya Clinic, your home of healthy living. Today, we are talking about an important health issue that affects thousands of women every year, cervical cancer. Cervical cancer is a type of cancer that develops in the cervix, which is the lower part of the uterus connecting to the vagina. It is one of the most common cancers among women, but the good news is it is preventable and treatable if detected early. One of the main causes of cervical cancer is the human papillomavirus, commonly known as HPV. This is a virus very common, mainly spread through sexual contact. While many HPV infections clear on their own, some types can lead to cervical cancer over time. So, what are the signs and symptoms to watch out for? In the early stages, cervical cancer may not show any symptoms. However, as it progresses, symptoms may include unusual vaginal bleeding, bleeding after sexual intercourse, pelvic pain, or abnormal vaginal discharge. Ladies, if you notice any of these signs, please seek medical attention immediately. Now, let's talk about prevention, because this is where we can save lives. Regular cervical cancer screening such as pap smears or HPV tests helps detect abnormal cells before they turn into cancer. Women are encouraged to start screening as advised by their healthcare provider soonest. Another powerful prevention measure is the HPV vaccine. This vaccine is safe and effective and is recommended for girls and young women and even boys even before they become sexually active. Maintaining a healthy lifestyle also plays a role. Avoid smoking and attending regular health checkups can significantly reduce the risk. In conclusion, cervical cancer does not have to be a death sentence. Early screening, vaccination, and awareness saves lives. Let's encourage our mothers, sisters, daughters, and friends to get screened and vaccinated. That's it for today's healthy living tip on Afya Clinic. Stay informed, stay healthy, because your health is your wealth. Until next time, my name is Faith Poema.
Your health is your responsibility. I love that we need and we keep saying that your health is your responsibility. You're really the one to take care of your health. Once you have all the information that you need, it's for you to decide that I'll take care of my health and that I'll be responsible for what happens to me. And then there's a place of prayer, there's a place of hospital, there's a place of nutrition, but you have to make the decision first. Yeah? So make the decision, decide today that you're going to take care of yourself. All right? Now, people are asking Sana about cost. Yeah, in general. Asking, we keep saying that treating cancer is very expensive. Mm-hmm. Is there a way that as Liberty or the healthcare sector, have you put anything just to make sure that the cancer patients are helped with reducing the cost or carrying the burden of the cost?
Okay, yeah. So I know we've talked about cost. Sophie has talked about how cancer is very expensive. And we thank God for national institutions like SHA. Though you still find that most people, they don't have SHA. Yeah, despite the fact that there's been maybe that call that everyone should have a SHA cover. There are some people who do not have SHA. But you find that for cancer patients, SHA have really come in handy in assisting in treatment, chemotherapy, radiotherapy, brachytherapy. So we encourage them to have their SHA covers active, and it really helps a long way. There are also other insurance companies which pay for such illnesses. And also we have some organizations which come in and assist. So you find that as long as you have SHA, you know, even for that person who has a very low income, they can pay some amount. I saw even recently they introduced maybe lipa mdogo mdogo, but still it's a call to them maybe if they can at least raise the charges for cancer patients, because you find that the medication for cancer, the treatment for cancer is expensive, and probably whatever they are given maybe for a year might not be sufficient enough. And also it might be expensive for the patient to go back to their pockets and pay. So probably they should look at increasing the limits for the cancer patients. But for those who have the covers, at least I can say that it's helpful. And also having other insurance companies, it's good for one to have an insurance company. I know that most of the people do not have insurance, even SHA. Somebody tells you that, why should I pay? Misi mgonjwa, you see? We have a lot to do out there. Because when now they get sick is when they see the importance. But why don't we just have these covers? Put our children, put our spouses into the covers, so in case of anything like this that happens, it's not like we are saying that it will happen, but just in case it happens, you are covered. You're covered. Yes.
And as you've said, not only SHA is very important, but in general, medical covers. Make sure at least uko na medical cover hata moja. You know, I know you're covered by the blood of Jesus, hallelujah. But you need a medical cover. Ni vizuri mtu ajipange. Ni vizuri mtu ajipange. The Bible says that a wise man one account costs. Ya kila kitu. So it's very important. Now, Sophie, for the people who've watched us today, and you know, we have so many men and women, and today they've learned so much. They're probably vitu zingine wamesikia leo for the very first time. What would be your word to them in terms of the conversation that we've had today on cervical cancer?
I think we came to create awareness. I've just remembered that maybe we are having patients who are also watching. And we have been addressing those who are addressing them, but maybe amongst those who are watching, we have patients. Number one, I'd wish to tell them that it is not a death sentence, as we keep repeating here. And the fact that you are sick does not mean you are a bad person, especially cervical cancer. It is not your fault, woman. It is not your fault as I look at you. It is only that what happened, and deep down, going back, maybe looking back at the end of time, you could change the hand of time, you would not be in the same position. But since it has happened, can we walk the journey? I'll give out my number in case you want free counseling, you want a shoulder to lean on. Just know, we do not blame you. It is not your fault that you're suffering from cervical cancer. And for those who have not even gone for the screening, this is when now we hear women come and tell us, I wish I knew. I wish I knew. For now, you know. As an organization, we don't want women dying because of lack of information, lack of screening. We do not take pride in such things. So for us, what we want to say is that we are walking the journey. We hear you, we see you, we feel you. But please, go get checked. It's actually what happened, because I've done it. I usually do it. Most of the women who are scared, the nurse in charge just tell you, inhale. By the time you exhale, you know, these are the procedures you're not supposed to maybe disclose on. But it's just as simple. It's not painful. Vuruta hewa ndani. Ni hivyo. Sasa umemaliza hivyo tu. Just a simple relaxing muscles thing. These are things we do. Uko tunaambiwa Kegel muscles, sijui nini hizo take forever. Hiyo ni dakika ya sekunde moja. So kindly go get screened. If you're already a patient, kindly come for our support group. We shall be there. I'll be there personally. We shall heal our childhood trauma. We shall remember what until we come to adulthood. So please come and heal. We are going to heal. Actually, cervical cancer is green. Green regenerates. So hizi ni wakati wa ukame, lakini kuna sukuma bado iko. So green symbolizes growth. Whatever had died is growing back. The cervical cancer month calendar is usually green. It's a very passionate thing. Green imetoka kwa udongo. So we are holding you and you're going to grow together with you. Should I give my number now?
Yeah.
Okay, so our organization number this is our WhatsApp number. You can call or write WhatsApp. 0785 66 3100. 0785 66 3100. Hiyo utanipata directly. We can talk for any time, any hours. Call that number free. Utanipata, we'll cry together with you.
Okay.
Thank you.
Asante sana. Wow. And we'll be taking the number is on your screens, so you can always call, and I know that you'll get the help that you need. What would be your parting shot?
Okay, first of all, I would like to tell those people who have not been screened, we are continuing with the free screening until the end of this month. You can walk to our facility. Even now as we talk, you will be assisted. We are located at Assumption Center, next to Vaccination Hospital, third floor. And our phone number is 0790 658 888.
Take it again.
0790 658 888. That is our phone number. If you have any questions, if you want to know more about cervical cancer and any other cancer, or even the services that we offer at Liberty Cancer and Wellness Center, if you call that number, you will be assisted. I also invite them for our support group meeting, whereby we will be working with organizations like WISE, and we work with many organizations to make all this successful, because alone we cannot do it. So for the support group meeting, we'll have it next week on 30th, the last Friday of the month, but the screening is ongoing. So don't fear, come for screening, and you will be taking charge of your health. So I would just like to tell our viewer out there, get screened regularly, take your children for the HPV test. Make sure that you seek medication early, and remember that early detection is key. Yes.
Very important. Asante. Maybe you can repeat the location of the hospital. I see we have someone was giving some symptoms and asking where the hospital is located.
Okay, we are located at Assumption Center. Assumption Center, third floor. Our facility is called Liberty Cancer and Wellness Center. So when you, in fact, when I talk about Vaccination, probably somebody knows Vaccination more. We are just next to Vaccination Hospital, and maybe I can give them our phone number again so that they can call and be given the directions. Our phone number is 0790 658 888.
Perfect.
If you call that number, you will get the direction and all the information that you need.
All right. Asante. That was such a wholesome discussion that we've had today around cervical cancer. And I hope that this won't be the last time that we're talking about cervical cancer. As you said, is that it's very important for us to continue with the sensitization. So pale nyumbani pia, let it not be the last time that we're talking about it. You said it's not a taboo. It's very important for you to talk about it so that you'll have the knowledge, and the people around you will have the knowledge about what that is. If it's possible, please be available for the support group, the event that will be happening next week on Friday. Itakuwa inafanyikia wapi?
Hapo to Assumption Center.
Assumption Center at the hospital.
CDN Hall.
Okay. So make sure you make your way there. From what time to what time?
From 9 to around 1:30.
9 to 1:30.
Yes.
All right. So make your way there, and I know that you'll get all the information that you need. Go support, go listen, just be there. Your presence is very important, right? Once again, asanteni sana. That has been such a wholesome conversation.
Thank you.
Yeah, that has been such a wholesome conversation. I've also learned so much today. And I hope that you've learned so much today as well, and that what you've learned, make sure that you share as well. Now, before we wind up, I'd like for us to get the Did You Know segment. This is a segment that just allows us to joke our minds a little bit after the conversation that we've had. If it's ready, we get the Did You Know segment. All right, perfect. So we'll be getting the Did You Know segment on this particular show, but next week on Wednesday. Yes, next week on Wednesday, same place, same time on the Did You Know segment. But for now, thank you so much for tuning in. It has been such an amazing time. God bless you. Thank you so much for choosing to watch MBCI TV. As we say, is that we do value your time greatly. Now we'll be having the 21 days of prayer and fasting. Hatujamaliza bado. Itakuwa inaenda mpaka 1st of February. So that means today we'll be having our lunch hours from 12:30. On Friday, we'll be having Kesha. Itakuwa inaanza 9:30, but every morning we have our morning devotion starting at 5 a.m. Prayer and fasting is very important. All right? It helps you grow your spiritual life. It helps you be nourished. So that is very important. Follow. If you're in Nakuru, please come. If you're not in Nakuru, you can always follow through our social media pages and through MBCI TV and radio. So be part of this, and I know that you're going to get blessed. Others do have an amazing rest of the day. God bless you. God be with you. May everything you touch prosper. My name is Rachel Kahugu. I'll see you on the next show, God willing. Bye-bye.